Hello, everyone. This is Empress Pamela. It's been a long time since I did a Cancer Chronicles and Cancer Journey update. I do want to share something important with you all. This is what I found at my doctor's office, my cancer doctor, Jennifer McNally, at Duke Women's Cancer Center. They had this right out there in the waiting room. And I thought, wow, this is amazing. Endometrial cancer doesn't get a lot of press. And come to find out, I don't know if you're familiar, but there is a lawsuit, a class action suit going against, filed against, what is it? The hair relaxers. And it says if you have ovarian or uterine cancer or something like that, but they neglect to mention endometrial cancer. So I wanted to share with you some information. Now, this is about advanced endometrial cancer. If you've been following my journey back in 2021, so almost 3 years ago, December 27th, 2021, which was my son's birthday. That's why I remember it so well. I was diagnosed with endometrial cancer on January 10th, 2022, like barely 2 weeks later. I had my surgery, complete hysterectomy, and my staging came back as 1A, so that was amazing. I did not have to go through chemo or radiation, but it's been every 6 months I have to go and do what do they call it? Surveillance visit. Yeah, surveillance. So I had my recent surveillance visit a couple of weeks ago, and I was told that April, so 6 months from now, April 2025 will be my last 6 months, and then I'll go every year for the next couple years, and then I won't have to go. So we're kind of in the middle of the surveillance stage of my cancer journey, but I want to share with you some of the information about endometrial cancer and share with you symptoms. Okay, that's important. So I'm going to be reading. I hope you find this helpful. I know it's important. I didn't have a lot of these symptoms. My main symptom was I had a discharge that was like, almost looked like crystals. It was like a clear crystal discharge. They don't mention it in here, but that's the only symptom I can really think of, other than me being morbidly obese and of a certain age, Anyway, I'm going to read the information they have about endometrial cancer. Okay, so welcome to Health Central's Guide to Advanced Endometrial Cancer. In these pages, you'll learn about your diagnosis, the latest treatments, and current research. You can also follow the inspiring story of someone with advanced endometrial cancer. For more information, go to healthcentral.com/endometrial cancer. Bleeding after menopause is one of the biggest endometrial cancer warning signs. Learn how advanced endometrial cancer develops and what your cancer stage really means. Okay, and I'm reading from here, this article. Okay. Getting diagnosed with endometrial cancer, EC, can be scary, particularly if your cancer has reached an advanced stage. Understanding how endometrial cancer develops, as well as the stages of the disease, can arm you with the knowledge you need to prepare for your treatment journey. Endometrial cancer, a form of uterine cancer, is the most common type of cancer of the female reproductive organs in the United States. The uterus is the entire organ and it is made up of different layers, says Sarah Kim, MD, a gynecologic surgeon at Memorial Sloan Kettering Cancer Center in New York City. The outer layer is called the serosa, the inner layer is called the endometrium, and in between is the muscle layer, which is called the myometrium. Uterine cancer refers to all of those layers, but endometrial cancer refers only to cancers that start in that inner lining. The endometrium helps the body prepare for pregnancy each month during the reproductive years. It changes in response to hormones and is also what builds and sheds each month when you have a monthly period, Dr. Kim explains. This process stops once you reach menopause. That's why postmenopausal bleeding is one of the biggest warning signs of endometrial cancer, says Andrew Burchuk, MD, gynecologic oncologist at Duke Cancer Center in Durham, North Carolina. Before menopause, abnormal bleeding in the form of bleeding between periods or a change in your normal periods can also be red flags. Other signs that you may have endometrial cancer, especially at a more advanced stage, include weight loss, feeling a mass, bloating, or an increase in abdominal girth. Early satiety can also be a sign, which means you feel fuller after eating smaller amounts than you typically would, says Dr. Kim. Abdominal pain and changes in bowel and bladder function can also be symptoms of more advanced disease, Dr. Burchuk says. Who's at risk? Risk factors are based on the type of endometrial cancer you have, endometrioid or serous. I'm going to show you the word. Okay. Most endometrioid type EC appears to be fueled by hormones impacting growth of the endometrium. The main risk factor for endometrial cancer is estrogen. Dr. Burchuk says, endometrial cancer is twice as common in overweight women and more than 3 times as common in obese women compared with women who are at a healthy weight. The theory is that fat tissue can lead to increased estrogen levels, which make endometrial cancer more likely to develop. Other things that impact your hormone levels can also increase the chance of developing this cancer, including taking estrogen therapy after menopause without also taking progesterone, having polycystic ovarian syndrome, or taking the drug tamoxifen. Family history of endometrial or colorectal cancer, eating a high-fat diet, having had endometrial hyperplasia in the past, and having type 2 diabetes have also been linked to endometrial cancer risk. While many endometrial cancers are caught early, certain factors may also make you more likely to develop advanced stage endometrial cancer. For example, the serous type of endometrial cancer is more aggressive and more likely to be diagnosed when it has already reached a later stage. While serous endometrial cancers are rare, they account for nearly 40% of all deaths related to endometrial cancer, according to a 2021 study in the International Journal of Gynecological Cancer. These serous endometrial cancers aren't fueled by estrogen in the same way as the endometrioid type, but rather may be linked to genetic mutations, Dr. Kim says. For example, having hereditary breast and ovarian cancer syndrome, meaning you have inherited certain genetic mutations like BRCA1 or BRCA2, may make you more likely to have advanced stage serous endometrial cancer. The major genetic disorder associated with endometrial cancer is Lynch syndrome. Having this condition raises your risk significantly. Lynch syndrome. Okay. Older age and being African American are also factors associated with more aggressive types of endometrial cancer that tend to not be diagnosed until later stages, Dr. Burchuk says. Understanding your stage. Beyond cancer type, your doctor will also assign your cancer a stage. Staging has to do with prognosis, meaning how likely the cancer is to come back, Dr. Kim says. It guides our decision about whether you are able to get surgery at the time of diagnosis and whether you should get adjuvant treatment, meaning treatment in addition to surgery to reduce the risk of recurrence. The staging system for endometrial cancer was updated by the International Federation of Gynecology and Obstetrics in 2023 and takes into account factors such as histological subtype, where tumors may have spread in the body, and molecular subtype, which is based on genetic testing of the tumor, Dr. Kim explains. FIGO system assigns cancers a stage 1 through 4. Numbers increase with how advanced it is. Stage 1 and 2 endometrial cancers are confined to the uterus. Stage 3 and 4 cancers have advanced outside of the uterus. For example, stage 3 cancers may have spread to the ovaries, fallopian tubes, vagina, or pelvic lymph nodes, among other places. Stage 4 cancers may have spread to the inner lining of the bladder or rectum, to lymph nodes, and to distant sites like the upper abdomen, liver, bones, and lungs. A path forward. A diagnosis of advanced stage endometrial cancer is far different today than 10 years ago, with new treatment options available that provide hope, including immunotherapy and other targeted treatments. Plus, researchers continue to explore ways to take advantage of a cancer's molecular subtype to kill tumor cells more effectively, Dr. Kim says. Here, if you want to take a screenshot, 5 terms to know. Okay. And what was the other thing I saw in here? That, I think I saw it in here. Cancer support groups. Okay. Share cancer support. What was that other thing? Well, what was the other thing I wanted to talk about? The that class action lawsuit. Although it doesn't say endometrial cancer, I've seen it in 1 or 2 that were advertising it. But if you have used hair relaxers, it's worth looking into class action lawsuit. Hair relaxers for women with uterine, ovarian, and endometrial cancer. I would suggest you look into that because, as we know, cancer is no joke. Medical bills abound. Quality of life can be affected. And I hope you got something out of the information. I was so excited to see my type of cancer in the spotlight, as queer as that sounds. I mean, it's true. So I'm glad to share it with you, and I'll see you in the next one. Take care.